So my name is Irihapati Mahuika, he uri tēnei no kaitahu, no te taipotini, and I work at Pegasus Health in Canterbury, and I'm going to be facilitating this session today. I'm going to now ask the panel to introduce themselves and ask each member a series of questions. So let's start with you, Whai Bill.
Ai, kia ora mai tata katoa e noho mai nei ki te mātakitaki ia māta katoa. Ko Merle Makuna Samuels hami ora ahau. Ko au, tēnā he consumer for this enhanced model of care with healthcare homes.
Kia ora.
Me.
Kia koe, Lance.
Morena koutou, ko au, ko mango piko te maunga, ko awaro te awa, ko te reo mihi me waiora nā marae, ko Ngāti Kuri te iwi, ko te rarawa, ko Ngāpui, ko Ngāti Whātua aku iwi, ko Lance Norman taku ingoa. I'm Lance Norman, and I'm on this project, I'm the head of equity for the Healthcare Homes Collaboration, but I'm also the head of equity for ProCare Health based in Auckland. Kia ora.
Tēnā koe. Kirsty?
Kia ora, I'm Kirsty Lennon. I'm a GP up in Kapiti, and I have been on the healthcare home journey for 5 years. I am a GP up here, but also I'm the healthcare home clinical lead for Te Ora Campus, and I've been helping the collaborative with the review of the model of care.
Ka pai, and finally to you, Ents.
Kia ora, ko Ants Takawingoa, ko Whanganui te awa, ko Raupohu te maunga, ko Parakino te marae, ko Atianui a Paparangi te iwi. My name is Ants Tamoa. I am practice nurse manager for a practice in Lower Hutt, have been part of the healthcare homes journey since it started. Kia ora.
Tēnā koe, and tēnā koutou. So let's start with our first question, and this one's for you, Whai Merle. How do you think consumers will benefit from this enhanced healthcare home model of care?
I believe that the consumers will benefit from this enhanced model of care through the consumer co-design. What we did was that through whakawhanaungatanga, we were able to see how that works, how it's heard, but through the Healthcare Homes Collaborative, or our, excuse me, when we've been feeding in, I have heard the voices of consumer. I've never thought before how that could make the difference. Coming to a point now and realizing through whakawhanaungatanga and having been heard, hearing the voices and the concerns of many who have lived experiences has helped me to know that there are gaps. So healthcare homes and the enhanced model has made access easier, not only for Māori, but the top or high priority groups are out there. So they're able to come in with ease. I believe it's through the voice that has been shared, but we've been able to do a wee bit more than just hearing the voices. Our whole team has been able to work and embed whakawhanaungatanga so that the tentacles of that are actually reaching out and touching others. We know that whakawhanaungatanga is a lived exercise, so we embed it, and those concerns about feeling heard, feeling validated, and with the enhanced model becoming transparent. We know it's a process and model. It's a model that is in working process, my apologies. And I believe that having heard the consumer voices, we've been able, maybe not watertight right now as far as the framework goes, because it is a process that is still in working motion. I believe that we can help that to become more so, but it will be the consumers, the patients, the people using the service that will let us know, and they will see how the equity in there to not only improve what they're receiving and where in the clinic. It is an awesome way to feel if we were ever going to help make a difference, that the consumer voice has done that, and so has the healthcare homes teams that have worked on this to make sure that those voices are embedded. So kia ora mō tēnā iri hapiti.
Kia ora whaia, tēnā koe. He pātai kia koe, Lance. How you were on the steering group for this project. Why was it so important for you to be involved?
In health, we have this acronym called DNA, which stands for did not attend. I interpreted DNA as did not attract. So at two levels, our Māori whānau are not accessing healthcare services to the same level of non-Māori whānau. So we needed a system that was whānau friendly, and as Whaia Merle has said, it needed to be co-designed and inclusive of whānau voice and whānau lived experience. But it actually needs to connect to the healthcare system. So I want a system that says, how do we attract whānau into the healthcare system rather than how do we put up barriers? I also personally have 4 young children who have Māori descent, and I want them to grow up in the best healthcare condition they possibly can. So if I can influence healthcare change, I would love to do that through this process. Kia ora.